Welcome to the Women's Health Channel. My name is Gabriel Igberasi. Today I'll be talking to you on one of the harmful practices against women's health in Nigeria, and it is called the insertion of herbs, concoctions into the vagina to treat some gynecological conditions like infertility and uterine fibroids. These practices are done by traditionalists, traditional birth attendants, and they are practices that have been handed over from generation to generation. We're in the 21st century, the world has moved over, and we should not be involved in such practices. It should not be named amongst our women. It is our duty to educate our women against these harmful practices. They are fraught with lots of complications. So women's reproductive career has been halted as a result of performing these procedures. They are not evidence-based, and they are not practices that are regulated by anybody or the government. So we should take note of this. These substances have chemicals in them, and when they are inserted into the vagina, they cause some chemical reactions, and these reactions will go on to burn the tissues all around, the vaginal tissues, the cervix, which is the neck of the womb. Sometimes it can burn the tissues close to the bladder. The women starts leaking urine from the bladder. Sometimes these chemicals will burn the tissues close to the rectum, and they start leaking physics through the rectum. This is what I have seen. This is what I have palpated. So I'm not talking stories. So I am warning our Nigerian women to desist from these practices. Apart from that, there are some long-term complications when this is done. The vaginal walls, they heal by being plastered together, gummed together, so that you will not need another surgery called reconstructive surgery to open up the vagina. And it is a difficult surgery. And in that surgery, you don't do it once, you can do it even more than once, and usually 2-stage, 3-stage, and you take tissues from the thigh, from other parts of the body to form a new vagina. Right? We also see situations where the neck of the womb gets closed as a result of this. We also see situations where the vagina gets totally closed, that even when we do the repair, we may not have enough vaginal tissues left. So the vagina will not be as it was before. Now, this is the trick. They tell you, oh, this is the fibroids. This is what is causing you're not able to get pregnant. It's a lie. What happens is that these chemical substances, when they burn your vaginal walls and your tissues, what comes out, the tissues that comes out, the burnt out tissues, they show it to you, and they say, this is the fibroids, this is it. And it is wrong. It is not true. And we found out that the complications are not just short term, it could be long term. You could have infertility, you could have, chronic pelvic pain. You now start having pain. If the neck of the womb is closed and you still menstruate, you can have blood and pus inside your womb. So it's a very, very bad practice. It is not true, and I would advise our women to desist from this practice. If you have fibroids, go and see your doctor. It's specialist doctors who are specialized in removing fibroids. The definitive way of treating fibroids is removal of the fibroids. You either remove the fibroids or remove the womb. If you have challenges with getting pregnant, there are steps, there are procedures that will be taken for you to get pregnant. Like I normally tell people, there's no shortcut in life. Life is procedural, so you must follow procedure. So let us desist from this. Let us advise our women, inform them, educate them, counsel them, tell them about these harmful practices, that it doesn't work and it leads to untold complications. Thank you very much for listening.